Hi, and welcome to your January safety meeting. We're going to be going over bloodborne pathogens, first aid and CPR, and pandemic preparedness. This is all from OSHA CFR 1910-1030 and some industrial best practices. Here we have the course objectives. So we want to understand bloodborne pathogens. We want to understand how disease is transmitted. We want to determine personal exposure risks, protect yourself from exposure, appropriate and immediate response methods, understanding medical evaluation rights and your own protection, ensure person or persons receive appropriate care, and maximize operational tempo while minimizing the risk. So what are bloodborne pathogens? Well, they are microorganisms present in human blood that can cause diseases. So viruses, bacteria, parasites, and fungi. Primary workplace pathogens would be human immunodeficiency virus, or HIV, hepatitis B virus, or HPV, and hepatitis C virus, HCV. HIV leads to AIDS. HIV attacks and depletes the human immune system. Early HIV symptoms resemble flu virus. HIV antibody tests are the only way to know for sure. And HIV does not survive outside the body, and we have not found a cure yet. We also have hepatitis B virus, or HBV. So 1.4 million people are infected. Symptoms are jaundice, fatigue, and abdominal pain. You'll lose your appetite, you'll be nauseous, you'll vomit. A vaccine is available, though, for hepatitis B. HPV can survive outside the body as well, so it can survive in direct sunlight for a long period of time in dried blood and other surfaces, so it's important that we get these cleaned up as quick as possible. Hepatitis C virus. So HCV is the most common chronic bloodborne infection. There's 3.2 million people infected. Symptoms can take years to manifest. Flu-like symptoms, jaundice, dark urine, and fatigue, loss of appetite, nauseous, and vomiting and abdominal pain. Treatment is only marginally effective for this. Transmission of pathogens. So contaminated sharp objects or needles, broken skin, including rashes, and mucous membrane, so your eyes, your mouth, and your nose. These are the different routes of exposure. So contact with bleeding coworker, contact with blood while administering first aid, touching a contaminated surface, a sign to clean up blood, contact with contaminated products or equipment in the restroom, and using a tool covered in dried blood. That's why it's vitally important to clean up any blood immediately to make sure we do not spread any of these. We have bloodborne pathogen law. So we have medical surveillance, free hepatitis B vaccinations that your employer has to give to you if you request. We have different signs and labels we'll set up as well. And we have other equipment and procedures that your company might have or that OSHA requires. You want to take what's known as universal precautions. So we're going to treat all blood and bodily fluid as if it's infected. We use barrier protection to avoid contact with infected bodily fluids, and immediately clean up and decontaminate surfaces and equipment. We want to use personal protective equipment as well, so barrier protection prevents exposure, so something like gloves. When you're applying bandages or cleaning up, it's always important to wear gloves. Make sure that you are not getting any of that infected material on your hands. Eyewear or masks also protect against splashes, which can be vitally important because, again, the mucous membrane, the eyes, the nose, the mouth. We also have protective clothing like aprons or something like that can protect against blood. You can use a mask for nose and mouth protection. You can also use a CPR mask when you give CPR. This avoids your mouth coming in direct contact with their mouth. Be prepared to use impromptu barriers such as a garbage bag, plastic, any paper you might have, or your shirt. Just something to avoid direct contact. You want to avoid any kind of puncture wounds as well. Use tongs, forceps, or similar tools to pick up potentially contaminated items. Now we get to the subject of general decontamination. You want to wear appropriate gloves and glasses to protect your eyes, nose, mouth, and skin. Use bodily fluid disposal kit. That will help you clean up anything you need to in a very effective manner. Make sure that you are using the proper equipment. Use 10% bleach or EPA-approved disinfectant for any kind of spills. Also, dispose of contaminated items. Make sure you dispose of them properly. Bloody gloves and things like that cannot just be thrown in the trash. They have to be thrown into a red bag or a biohazard bag to make sure everybody knows, hey, this has potentially infectious material. So involving sharp objects, you want to remove glass and other sharp materials using a brush and dustpan or tongs. Never use your hands. And use paper or absorbent towels to soak up the residual liquids. Also, disinfect all surfaces and allow time to dry before using again. Biohazard disposal, so regulated waste. Liquid or semi-liquid blood or other potentially infectious materials. Contaminated items that would release blood or other potentially infectious material if compressed. Contaminated sharp objects. Item caked with dried blood or other potentially infectious material, or OPIM, whatever you want to call it, capable of release during handling, and pathological and microbiological waste containing blood, or OPIM. You have to label all regulated waste containers as well. So labels communicate a hazard. They tell you, hey, there's a hazard here. Place regulated waste in containers that have the universal biohazard symbol as shown on screen. The term biohazard must be on the label. For different exposure incidents, always wash cut and skin thoroughly, rinse nose and mouth, flush eyes with clean water or sterile solution. Also clean all contaminated surfaces, report post-exposure evaluation. So confidential medical evaluation, you should go get checked out, make sure that you are okay. You want to document the route of exposure, you want to identify the sources or source individual, and test source person's blood. You should provide results to source and exposed employee so they both know what's going on. Then we also have the hepatitis B vaccine. It should come at no cost to you. It's 3 shots. Initial shot at 1 month and at 6 months. It's effective for 95% of adults. Post-vaccination testing for high-risk HCW. Post-exposure treatment, if not vaccinated, immune globulin, and begin vaccination series. If you decline, you must sign a declination form. So your company will give you a declination form saying, hey, I'm declining hepatitis B vaccine right now. But at any point that you want it, if you desire it, they have to help provide it for you. So here's a summary. Bloodborne pathogens can cause fatal diseases. Always be aware of exposure at work. Always take universal precautions. Use PPE and safe work practices. Decontaminate yourself and equipment. And understand and follow exposure incidents procedures. And report exposure incidents. So basic first aid and CPR for adults. Introduction before giving care. Here we have the key points. So the purpose. Help participants identify and eliminate potentially hazardous conditions. Recognize and make appropriate decisions for first aid care. And this course will teach you skills that you need to give immediate care until more advanced medical care arrives. Again, we're not always going to be able to give top tier care, but we can give the best that we possibly have. Body does not produce enough insulin or does not use insulin effectively. That would be a diabetic emergency. If victim is conscious and able to swallow, give sugar or glucose. If victim is unable to swallow or sugar is not available, call 911 immediately. A high blood sugar and a low blood sugar, they are both diabetic emergencies and are 911 emergencies. For poisoning, I'm going to give you a definition first for poisoning. Any substance that could cause injury, illness, or death when introduced into the body. And we have 4 main routes of exposure for everything. We have inhalation, we have ingestion or swallowing, we have skin absorption, and we have injection. Inhalation is usually going to be our greatest dangers because it's the one thing we can't stop doing. You can stop eating, drinking, you can avoid touching things, you can avoid being poked and prodded, but we have to continue to breathe. A good example would be H2S. So treatment. If life-threatening, always call 911. Call Poison Control Center and follow their directions. The number is 1-800-222-1222. Do not give anything by mouth. Here's an example of the recovery position. So this is what you do when somebody is unconscious, but they are still breathing normally, and they have no outward wounds. You put them in the recovery position to drain fluid out of their mouth. We're going to talk a little bit about overcoming barriers to act, because it can be very hard to act upon your training when there are other people around or if you're uncertain of things. So again, here's some barriers that we might have. The presence of others, the uncertainty about the person's condition, fear of catching a disease, fear of doing something wrong, fear of being sued, and being unsure of when to call 911. These are not unfounded fears. These are regular things that everybody feels. But we want to try to overcome these barriers to make sure we can provide care for people. So we do have the Good Samaritan laws. These were enacted to protect people who voluntarily give emergency care without accepting anything in return. These laws protect you as long as you act in good faith. You can't show up to a hospital room later and say, I want $10,000, I saved your life. But you have to act in good faith. Are not negligent, and act within the scope of your training. So you do not give a tracheotomy. I don't care how good the tracheotomy is, you will be arrested. It is outside of your scope of care. We should always obtain consent before helping anybody. So to obtain consent, state your name. Tell the person that you were trained in first aid and CPR. Ask the person if you can help. Explain what you think might be wrong, and explain what you plan to do. If somebody tells you, no, I do not want your help, it is illegal to touch them. That is assault or battery, an unwanted touch. So we must obtain consent. We'll talk about responding to an ill or injured person. So if you have a life-threatening injury or illness, it would be categorized as any of these: unconscious, not breathing or having trouble breathing, choking, persistent chest pain, no signs of life, so no normal breathing or movement, severe bleeding if someone goes into shock, or someone has a seizure that reoccurs or lasts more than 5 minutes. Some key points we want to discuss would be the 5 leading causes of injury related to death. So motor vehicle crashes, falls, poisonings, drownings, and choking. 2 basic types of injury would be soft tissue and musculoskeletal. So that would be your muscle, your bone, your joints, tendons, ligaments, things like that. So soft tissue includes layer of skin, fat, and muscle. Damage may be at the skin level or deeper in the body. A physical injury that damages the layer of skin is called a wound. Wounds are typically classified as either open or closed. This is the care for a closed wound. Apply direct pressure. Elevate the injured body part if it does not cause more pain, and apply ice or cold pack. Never put the ice directly on the skin, and leave ice or cold pack on for 20 minutes, remove for 20 minutes, then ice again for 20 minutes. These are different types of open wounds you could have, so abrasions or lacerations. This is how we control open wound bleeding. You want to elevate and apply pressure with a gauze dressing. If bleeds through the dressing, apply another dressing over. Never remove a dressing. So your body will actually help clot and try to close that wound because of the blood-covered gauze. You can also apply a roller bandage, so tie knot over the wound and tape the dressing. You always check fingers and toes for circulation. You want it just tight enough to help with bleeding, not tight enough to cut off circulation. We also have burns. There can be different causes for burns: thermal, chemical, electrical, and radiation. This is caring for a minor burn. Do check scene for safety, remove source of the burn, cool 1st and 2nd degree burns with cool running water, and cover wound loosely with a sterile dressing. You should never use ice, break blisters, remove pieces of clothing stuck to burns, use any type of ointment on a severe burn, do not immerse 3rd degree burns in water, and do not touch the areas of a burn with anything but a clean covering. For chemical burns, remove contaminated clothing if possible, brush off dry chemicals, and flush burn with water for 15 to 20 minutes. If it's in your eye, flush your eyes for 15 to 20 minutes and make sure that you get some medical attention to check them out. This is types of muscle, bone, and joint injuries. So fractures, breaks in bone. So open fracture, skin over fracture, broken. Closed fracture, skin over fracture, still intact. And a dislocation would be a displacement of a bone at the joint. These are just different types of bone and joint injuries you could have. We also have sprain, so partial or complete tearing or stretching of a ligament. And we have a strain, which is less intense, stretching or tearing of muscles or tendon fibers. So shock. Shock can develop from a serious injury that results from severe external or internal bleeding. Signs of internal bleeding would be tender, swollen, bruised, or hard areas of the body. Example, like your abdomen, you can push. It might be a hard, very severe, severely hard and raised, swollen, things like that. You can have a rapid or weak pulse, and skin that feels cool or moist or looks pale or bluish. Minor injuries and care. So certain injuries that are determined to be non-life-threatening fall somewhere between first aid and serious. Personnel have the right to see a medical professional. It is a common practice for people to visit an occupational physician who understands work injuries rather than an emergency doctor. There are various clinics throughout the region that specialize in workplace injuries, and this includes telemedicine as well. Then we have illness prevention. So the purpose of illness prevention: provide safeguards against potential spread of infection, ensure excellent hygiene, protect the public from potentially carrying illness forward, flatten the curve of viral spread, and continue critical business operations while trying to mitigate the risk. Prior to departing your home, wear clean clothes, utilize antibacterial soap and or hand sanitizer, pack all food inside of sealed bags or lunch boxes, utilize mouthwash, and check temperature. If it is above 99 degrees, do not depart from your home. Stay home sick that day. For travel, use gloves when fueling at gas stations. Do not enter any station unless necessary. If entering, continue to wear gloves and change out when returning to vehicle. Practicing professional glove removal. For restaurant drive-thrus and pickups, wear gloves when handling paper, plastic wrappings, and bags. After eating, utilize hand sanitizer or antibacterial soap. Workspace hygiene. Wash hands prior to entering the workspace. So if you're working in the shop, prior to entering shop, utilize hand sanitizer. Avoid handshaking. Use Lysol wipes on tools or equipment after handling. When you're working in the field, avoid handshaking. Clean all equipment after handling. Clean hand tools prior to storage in toolbox. Workspace PPE. So you can have PPE in the shop or PPE in the field. Just utilizing gloves and other things like that would be beneficial. That way you're not in direct contact with anybody. You can't spread illnesses. Working in the office, prior to entering office, utilize hand sanitizer, avoid handshaking, use Lysol wipes on computers, printers, and shared equipment. And then dining at work, utilize personal items or personal disposable items, wash hands prior to eating, and wash hands after eating. So public space PPE, so gloves, respiratory equipment, maintaining a distance, these are all great ways to avoid catching any kind of illness. Avoid entering public spaces whenever possible, utilize pickup services when available, and ensure hands are washed prior to entering public spaces. I want to thank you for joining us for this safety meeting. I hope that you guys learned something, and I hope to see you next month. Thank you.